But first, new travel restrictions and a test kit shortage in New York City as coronavirus concerns continue. The number of cases across the tri-state is growing. The outbreak now impacting Bergen County in New Jersey, along with New York City, Westchester, and Nassau counties. Right now, there are 22 cases across New York and 2 in New Jersey. CBS 2's Allie Bauman joins us now live in studio with the latest on this. Allie.
Well, Christine, New York health officials say the best way to contain coronavirus in our area is to interview the newest patients and then test everyone they've recently been in contact with for the disease. But tonight, local and federal lawmakers are both saying they do not have the resources to do that.
Many people will be infected.
The number of confirmed coronavirus cases has doubled in New York in less than a day. There are 2 new patients in New York City, a man in his 40s and a woman in her 80s. A 42-year-old Nassau County man has become the first positive case on Long Island, and Westchester County has seen the most dramatic spike, from the 50-year-old New Rochelle attorney who was the first infected to now 17 people linked to him who have also tested positive.
The goal now is to avoid community spread.
New Jersey is trying to track its first 2 positive cases in the state, including a New York healthcare worker in his 30s who lives in Fort Lee.
We do have Bergen County residents that were identified to have had contact with those from the New Rochelle incident, and those people are self-quarantined.
It's a race against the clock for disease detectives trying to trace the virus's path in our area.
We need the ability to test as many people as possible, as quickly as possible. We cannot do that without help from the federal government, period.
Right now, there are only 1,000 available test kits in New York City, the health commissioner revealed today.
We need the CDC to send more test kits because we anticipate that we're gonna burn through these.
We need the FDA to speed up approval of the tests developed by private companies. We need to get to the point where we can do hundreds a day, every day, maybe even more at some point. And we're not there yet.
Federal health officials say there should be enough coronavirus tests sent to public labs this week to cover about 400,000 people, which falls far short of demand.
We don't have enough tests today to meet what we anticipate will be the demand going forward.
President Trump brushed off questions today from reporters about the lack of test kits.
Mr. President, when will more tests be available?
I think we are in an emergency situation where we need to cut through bureaucracy to help get tests to market in a way that's safe, accurate, reliable, but really meets the demands that we're seeing in community.
The New York City Health Commissioner is hoping there will be some commercial lab capacity as soon as next week. Today, the Senate passed an $8 billion coronavirus funding package, which the president is expected to sign. Christine.